Early detection is key in treating any disease, and now thanks to advances in technology, lung cancer can be detected without major surgery. Dr. Robert McDonald is the pulmonary and critical care specialist at Waterbury Hospital and is here to tell us more about it. Welcome, Dr. McDonald. It's great to have you here.
Thank you.
First of all, let's talk about lung cancer. It is very difficult to detect. Why is that?
It's because the lungs don't have any pain sensation inside them, so the tumors can grow for a long time without causing any symptoms. But usually by the time they cause symptoms, it's too late. The lung cancer is already spread. It's at a later stage.
That's right. Often people are already coming in for something else, and that's when their lung cancer is detected. And so if it's detected at an early stage, it was just pretty much luck for them.
Usually, they had a procedure and needed a chest X-ray for some reason, and somebody saw something on the X-ray.
That's right. Now, we're here to talk about EBUS, the new EBUS technology. What is this all about?
EBUS stands for endobronchial ultrasound, and in the past, if we saw something when we did a bronchoscopy going through the airways of the lungs, we could see something in the airway. We could biopsy it, but oftentimes there are lymph nodes and things that are surrounding the airway that we couldn't get to. We would sometimes try to blindly put a needle through the tracheal wall, but oftentimes you would miss because you didn't know exactly where you were. With the endobronchial ultrasound, we can actually see the lymph nodes on the other side of the airway, and we can actually put a needle through the airway wall into that lymph node and get a diagnosis.
What's the benefit for the patient?
Well, in the past, if the bronchoscopy was not diagnostic, they would have to either go for an open procedure where they'd have to have their chest open in order to detect it, or they would have to go for something called a mediastinoscopy, which would involve an incision at the base of the neck. So we're basically saving them a surgical procedure.
Less invasive?
Much less invasive.
And would that mean recovery would be much easier?
Well, basically, the recovery from this is it's an outpatient procedure. They come in the morning. They're usually home for lunch.
Wow, that easy.
Yeah.
And the benefit for the doctor?
Well, we can accurately stage the lung cancer, so we know what we're dealing with, and really the stage is what determines the treatment for lung cancer. The earlier stages are more of an operative disease, where the later stages is more chemotherapy and radiation therapy.
And of course, the earlier you detect the lung cancer as well,
the better the prognosis.
The better the prognosis, and of course, the treatment also changes. What kind of treatments are available now for lung cancer?
Well, the earlier stages, if you can cut all of the lung cancer out, then an operation is really what you want to do. If you can't remove all of the cancer, then it's a very large operation, obviously, and you don't want to go through that if it's not going to be curative. So really, the stage determines what the treatment is. If you cannot remove all the lung cancer, then chemotherapy and radiation therapy are the way to go.
And what kind of benefits is that for the patient?
Well, nowadays, the newer medications, the lung cancers respond much better to than the old days. I mean, the old days we used to, it would be a race between which was going to get the patient the chemotherapy or the cancer. And now I think that the treatments are tolerated much better, and the patients do much better and get much better response rates.
So there's been advances as well in medication?
Yes, absolutely.
And prevention? We all know one of the major causes for lung cancer is smoking.
Right, and the best thing to do is to quit smoking before you have to see me and have any of these procedures done, and that's really the key. And there's more things available now to quit smoking. You can talk to your doctor about nicotine replacement therapy, the patch. There's Chantix, Wellbutrin. There's a lot of things that they can help. So you should talk to your doctor, but if you really want to quit smoking, talk to your doctor about it.
Well, as you know, that's very challenging. So when patients come to you, what do you tell them?
Well, I tell them it's hard work. It's something that you have to keep working at to quit smoking. The data shows that most people quit on their 10th or 12th try, not on their first try. So, and if you don't try to quit smoking, you're not going to. So the aids that we have make it a little easier to quit smoking, but it doesn't make it easy. It's still hard work, and you've got to work at it.
And we've just been told that President Obama has finally kicked the habit.
Yes.
So someone like him leading the charge, perhaps that'll motivate others to do so?
I hope so. I hope so.
That's great. Now let's talk more about this technology. Is the hospital the only one providing this type of technology, the EBIS technology?
We're the only one. There are several hospitals in the area that are now getting it. It's really a newer technology, and over the last couple of years. But I think it's becoming really the standard of care for diagnosing and treating lung cancer.
And what do you see down the road? If this is one of the latest, do you see more new advances coming down the road?
Well, we hope that we always wanted something a little easier, a little faster. There are some things with even looking at sputum cytology and earlier detection of lung cancer that way. The PET scanning over the last 10 years has really made a big difference in being able to detect cancer as well. So there's a lot of newer technologies out there.
And what about medication? Do you see more new advances in that as well?
Yeah, I have seen a lot of newer drugs out. Like I said, they're much better tolerated. And I know that they're always doing research at the Lever Center on newer modalities.
Clinical trials at the hospital?
Yes, there are. Well, at the Lever Center for cancer, and we actually have a detection trial at Waterbury Pulmonary that we're doing for early detection.
What is that all about?
It involves sputum samples. That we have people that have known lung cancer, just an expectorated sputum sample. They have some new ways to detect to see if they can detect cancer cells in the sputum as a screening before more invasive procedures.
And how will that benefit patients if the results are promising?
Oh, well, it would be either we'd be able to detect people earlier and obviously much less invasively.
I always say clinical trials are a good way for patients to get great care, as well as, of course, taking part in a wonderful study that could help others.
Right.
Well, Dr. McDonald, thank you so much for being here. We appreciate it.
Thank you for having me.
And if you want more information about Waterbury Hospital, all the information is right there on the screen, or come to WTNH.com and click on Connecticut Style. Coming up next,